For decades, the tools we had to treat depression were, well, they were effective, but they were pretty limited. But today, that's all changing, and it's changing faster than ever. So in this explainer, we're going to unlock what this new toolkit for mental health care looks like. It's filled with new strategies that are giving both doctors and patients something they absolutely desperately need, and that's new hope. So what's actually in this new toolkit? I mean, what does it look like? Well, it's not about finding one single magic bullet for everyone. It's really about having a whole range of options, everything from therapies that have stood the test of time to brand new cutting-edge medicines that work in ways we've never seen before. Okay, so here's our game plan. First, we're going to look at the standard toolkit, the stuff we've relied on for years. Then we'll get into the big challenge, the reason all this new stuff is even happening. After that, we'll dive into a new wave of medicine. And finally, we'll hit the psychedelic frontier. It's going to be a journey from the familiar to the truly revolutionary. All right, first things first, let's ground ourselves in the standard of care. For a long, long time, the main approach has always had two big pillars, right? You've got psychotherapy, or talk therapy, and pharmacotherapy, which is just a fancy word for medication. And look, these are the tools that have helped millions of people. Now, before we get into the numbers, there's a really important idea we got to get straight. Efficacy versus effectiveness. Think of it like this. Efficacy is how well something works in a perfect, controlled lab trial. But effectiveness, that's how well it works out here, in the real world, with real people and all the messy complications of life. And that distinction is absolutely crucial. So let's take a look at the real-world effectiveness of something like group cognitive behavioral therapy, or CBT. A study in just a regular psychiatric clinic found that 3 months later, 57% of patients had significant improvement. And get this, a full 40% were considered recovered. That's proof right there that our standard tools can be incredibly powerful. But here's the million-dollar question, right? Getting better is one thing, but does it last? What happens after the therapy sessions or the medication stops? This is where things get really interesting, and we start to see a major difference between our two standard tools. And wow, the long-term data is pretty striking. When you look at big reviews of lots of studies, it's clear. Psychotherapy seems to have more staying power. Check this out. 2 years after treatment ends, the relapse rate for people who had cognitive therapy was only 21%. But for those on medication alone, it was 50%. It really seems like therapy gives people skills that they can carry with them for a lifetime. Okay, so these tools are powerful. But what happens when they just don't work? For a huge number of people, these standard treatments simply don't give them the relief they're looking for. And this is the big challenge. This is the problem that's forcing the entire field of medicine to innovate. 1/3. Just let that sink in for a second. Roughly 1 out of every 3 adults with major depression doesn't get better, even after they've tried at least 2 different standard antidepressants. This is what doctors call treatment-resistant depression, and it is the single biggest reason why we so desperately need to expand that toolkit. So what are the alternatives? If the standard stuff just isn't cutting it, where do you go from there? Well, that's the question that researchers have been working on like crazy, and the answer is leading us to a whole new wave of medicine. And this brings us to some really exciting stuff, a new wave of treatments that are totally breaking the mold. We're not talking about just minor tweaks to the old drugs. No, these are fundamentally new ways of thinking about how to treat depression. Okay, take Spravato. It's an esketamine nasal spray, and its approval as a standalone treatment was a total game changer. See, instead of working on serotonin like most antidepressants, it targets a totally different system, the glutamate system. It's kind of like hitting a master reset switch on certain brain circuits. And the result? It's incredible. We're talking about patients who've struggled for years, seeing improvements in as little as 24 hours. Then you've got something like Exxua. Think of it this way. Traditional SSRIs are kind of like a shotgun, broadly boosting serotonin everywhere. Exxua is more like a sniper rifle. It's super targeted, hitting one specific serotonin receptor. So what's the big deal? Well, the practical benefit is huge. It's designed to help people avoid some of the most difficult side effects of the older drugs, like sexual issues or weight gain. That gives patients a really vital new option. And the innovation isn't just happening in the pharmacy. We're also seeing this incredible rise of digital therapeutics. Now, let's be clear. These are not your average wellness apps. These are FDA-cleared, prescription-only smartphone apps that deliver actual evidence-based therapy. Something like Rejoin, for example, is a prescribed treatment that aims to make proven therapies like CBT way more accessible to a lot more people. All right, now we get to the one everyone is talking about. It's maybe the most revolutionary area of research right now, the psychedelic frontier. I mean, after decades of being completely sidelined, these substances are finally being studied seriously, and their therapeutic potential looks, well, profound. And the results we're seeing from these trials are just remarkable. Let's start with this number, 71.2%. In a phase 3 trial for severe chronic PTSD, that's the percentage of people who, after MDMA-assisted therapy, no longer even met the criteria for the diagnosis. It's just incredible. And it's not just for PTSD. Take a look at major depression. A major study from Johns Hopkins on psilocybin, yep, that's the stuff in magic mushrooms, found that 58% of patients were still in remission a full year after their treatment. That's a huge deal. The potential just keeps expanding. This approach is also showing huge promise for addiction. In a trial using ketamine-assisted therapy for alcohol use disorder, they saw an 86% abstinence rate 6 months later. I mean, that's just an absolutely dramatic improvement over standard care. So what in the world is going on in the brain to cause these kinds of profound changes? Well, the key seems to boil down to one word: neuroplasticity. It's basically the brain's ability to rewire itself, to form new connections. And what these psychedelics seem to do is rapidly boost that ability. Think of depression as being stuck in deep, rigid ruts of negative thinking. These substances seem to shake things up, disrupting those ruts and creating this window of opportunity to reset the brain and carve out new, healthier pathways. Okay, but it is so important to pump the brakes here for a second. We have to understand that these are not approved medicines yet. The path to getting FDA approval is incredibly long and difficult. For example, just recently, an FDA advisory committee actually voted against approving MDMA for PTSD. They had concerns about the risks and how the studies were designed. It's just a really clear reminder that this whole process is super complex and, for good reason, very cautious. So, after all that, where does this leave us? Well, it feels like we're standing at a really pivotal moment in time. The old kind of limited toolkit is being replaced by something so much richer, so much more diverse, and it all points to one clear conclusion. The bottom line is this: more tools in the toolkit means more chances to find a personalized fit for each person. From talk therapy that builds skills for life, to new medications with fewer side effects, to digital tools you can use on your phone, and yes, these potentially transformative psychedelic therapies. We're building a future where treatment can really be tailored to the individual in a way we've just never seen before. And that really leaves us with one final big question. With a toolkit this diverse, one that's expanding all the time and offering real hope to people who thought they'd run out of options, are we finally entering a new, more hopeful era for mental health? It really feels like we're not just finding new treatments, but maybe, just maybe, a whole new, more optimistic and more effective way of thinking about mental health care itself.